Greetings, I'm Dr. Kim Kyung-won. Through online surgery, I'm honored to meet you. Today, I'm going to talk about various clinical cases and surgeries, and let's think about what implant is. Let's look at the panoramic image of today's patient, 42 years old male patient, and in number 47, the tooth is missing and there's no special medical history for this patient, and it has been a year since the patient extracted number 47. Although it has been a year because of the fear towards implant surgery, the patient did not go through the surgery. If you look at the CT in number 47, bone is slightly more translucent. It has been a year since extraction, and if you look at the surrounding bone, you can see that a lot of bone is condensed around the radiolucent area. Before extraction, due to some sort of chronic periodontitis, the surrounding bone was destroyed, and you can see that their sclerotic change has occurred on the CT. This is fully healed. In this patient, it is the most distal tooth, number 47. So Osstem OneGuide system is going to be used to place the implant in the accurate position. Using virtual surgery, I plan the case and the distance with the inferior alveolar nerve is sufficient. TS3BA diameter 5.0 by 10 millimeter implant was planned for surgery. On CT, once healed, the distal area of where the fixture is going to be placed, the bone density may drop a little bit, but placement will not be very difficult. So let's look at the drill sequence using OneGuide system. Initial drill is going to be diameter 3.5 by 10 millimeter and final drill 5.0. The two drills will be used for implant placement. This is a very simple sequence. And if you use OneGuide, when you place implant in the most distal area, you'd be able to consider the relations with tooth number 6 and vertical and horizontal relations more accurately. On panoramic image, this is the planned implant position and post-op panoramic image. You can see that implant has been placed to where we had planned it originally, and primary stability was very good. Healing abutment was connected and surgery was completed. Post-op CT. You can see that the implant has been placed to where it was planned, and the relation with the adjacent tooth, buccolingual relation, and depth, you can see that it has been placed well as planned. In the case of most distal tooth number 7, if you use OneGuide system or other digital guide system, you'll be able to do surgery in a most accurate way. Let's look at the surgery video.
한번 살펴보도록 하겠습니다.
In this case, there's very little attached to gingiva, so flap was reflected slightly and surgery is going to be done. If you use OneGuide template, most of you think that it will be flapless, but if necessary, you can open flap and prevent loss of attached to gingiva due to tissue punch.
좀 크게 해주셔야 돼요.
Open wider. Don't swallow. Open your mouth wider. In the case of most distal tooth, at times it can be difficult to find the path, so you need to pay more attention to it.
이럴 때 잠깐 살짝만 감으시고
Close slightly. Open wider, please.
한번 아프게
Open wider.
다시 한 번만
Open wider, please. In the case of hydrophilic implant like BA, you need to irrigate it first and then place it. Use a saline. You're going to use engine approximately up to 80% and using fixture driver and torque wrench. Once the OneGuide is in contact with the yellow marking, you'll be able to place the implant to the desired depths. Are you in pain?
아이고 수고했습니다. 자, 그 ISP 한 번만 재고 그다음 끝낼 거예요.
Let's measure ISQ value.
(80일입니다)
81.
이제 정리하고 끝낼게요.
Now we're done. Once suture is done, surgery is complete. When you use OneGuide, you think that flapless is a must, but if you reflect to flap a little bit, you can preserve the attached gingiva. This was a surgery case for number 47 using OneGuide.